A person, hemophiliac or normal, is injured. The blood hemorrhaging from the resulting skin lesion originates from damaged blood vessels. Vessel walls consist of an inner layer of endothelial cells and an outer layer of muscle fibers. Within the vessel, the blood circulates with each heartbeat, carrying with it the red blood cells and platelets. The injury results in a tear to the vessel wall through which blood leaks. Proteins within the ruptured vessel walls are now exposed to circulating blood. Platelets adhere to these proteins and become activated. The activated platelets then adhere to each other at the site of the wound and form a loose and temporary primary hemostatic plug. This process is independent of coagulation and occurs even in patients with hemophilia. Cells on the surface of the injured blood vessel express a protein called tissue factor. As the first step in the complex process of coagulation, circulating activated factor VII in the patient's blood binds to tissue factor receptors to form tissue factor factor VIIa complexes. Factor X is activated to factor Xa by the tissue factor factor VIIa complex and adheres to the activated platelets. The tissue factor factor VIIa complex also catalyzes the conversion of factor IX to factor IXA, which then combine with factor VIIA. This factor IXA factor VIIA complex catalyzes the formation of many molecules of factor X and catalyzes the formation of factor IIa called thrombin from factor II known as prothrombin. The thrombin molecules catalyze the formation of long, tough strands of fibrin from the precursor fibrinogen. These fibrin strands adhere to cells of the vessel wall and to the activated platelets and thereby form a tough, insoluble mesh. This network of fibrin helps to maintain the primary hemostatic plug and to prevent further bleeding from the wound until healing is complete. In the initial step of coagulation, trace amounts of circulating factor VIIa in the patient's blood bind to tissue factor receptors to form tissue factor factor VIIa complexes at the site of the wound. Factor X is activated to factor Xa by the tissue factor factor VIIa complex and adheres to the activated platelets. The tissue factor factor VIIa also catalyzes the activation of factor IX to factor IXA, but the factor IXA cannot bind factor VIII as this coagulation factor is absent in patients with hemophilia A. Consequently, factor IXA cannot activate factor X and so only small amounts of thrombin are formed. Because of this deficiency, only small amounts of fibrin can be produced. The resulting fibrin mesh is thin and loose, providing only an ineffective and leaking hemostatic plug.